of labor and delivery, then of course we can go into that a little bit like further. But the idea is that there are 3 stages. The transition is usually like the shortest, right? And so this is when we're at the pushing stage and, and actively getting baby from mom's body, earth side. And so, but within that, one of the most critical things is like, how are we going to manage pain during this process? It's a painful experience, and there aren't a lot of ways around it, but there are ways to make it easier. And so the idea of this is that we can have a birth process that is not, even if it's not easy, it can be a little bit easier. That there are some things that might make the process harder, maybe unnecessarily. Right, and that's something that we have to acknowledge, in that we can give ourselves like the skills to manage this experience. We can give ourselves some strategies to manage this experience. We can understand what the medical interventions are. So when I say interventions, we can think of them as like tools, right, to either start labor or to change labor, like in some way. And so this can be something like induction, which would be to start labor, like when it doesn't, when it hasn't started on its own. This can be something like breaking the water, the amniotic fluid. This can be, a pain relief like an epidural like medication. So we can think of these things as like, not that in a way that's framing them as like as bad, but it's like these are tools that have more impact at different points, right? And that they are also things that have their risk and their benefits as well. A lot of times we are only told about the benefits of something without being fully aware of what the risks are. So it's just important to kind of acknowledge that every single thing within the birth process is going to be on this kind of scale, that there are benefits and there are risks to everything. So another thing that's kind of really important for the labor and birth process is going to be maternal autonomy, right? Like a lot of people have birth experiences where they just feel like something is being done to them, and not that they are an active participant within this process. And so just to say like, hey, this is you, this is your life, this is your baby, this is your body, right? That is going through this event, that it's okay to kind of have something to say about it, right? Like a lot of times we hear people say, oh, my doctor is going to induce me on the 27th. And it's just kind of like, that's somebody making a decision for you that doesn't necessarily include you, right? Even though, you as the patient might carry like all of that risk that comes along with that. And so the idea of saying that you as a person matter within this experience, right? That you as a person should be empowered to give or to give your consent or not for anything that is happening, especially in the absence of an emergency. When it's an emergency, that's a different conversation, right? But whenever there is not an emergency, then maternal input is very important, especially whenever it comes to empowering people within their birth experiences. So this is another one of those things where a key component of the labor and birth process is really tapping into that support, right? For a lot of us, that will be our spouses, or that will be like our mom or our sister, or whatever that might look like, right? It's not always a trained professional that's guiding you through that. Sometimes it's just somebody that you love and that cares about you and the outcome that you have, and that matters. And so, but it's one of those things that people should not have to deal with alone, right? And so, but it's also to make sure that that the person that is supporting you through this process is truly supporting you in this process and everything that looks like. And so the other part of that, after you have the baby, congratulations, comes the postpartum, right? And so in general, like from the medical perspective, we think of the postpartum period as like up to 12 weeks, from birth up until like 12 weeks. And then, from the Islamic perspective, we see that the 40 days, like postpartum, is really considered that sacred time. And this is one of those times where this is a time of healing. This is a time of rest. This is a time of bonding, like with your baby, and also just letting the new family kind of experience what that means for them, when in reality, they are a lot of times bombarded with advice that they don't want or need, or help that isn't truly helpful to them. And so one of the things that we really want to look for during this time is just kind of protecting that space for, for the new family as they're trying to figure this out. And so I have here that like the postpartum like period is truly, in terms of healing, is truly a year. Like we say, okay, after you have the baby, after 6 weeks, you're going for like the checkup, and then after that you have the green light. Your bones are still not properly set back in place at 6 weeks, right? Like your organs have been pushed by a baby this way and that way or whatever, like for a long time. It takes a very long time for the body to really like get back to some type of norm. And sometimes it doesn't go back to itself like at all ever, right? And that's just the physical part. Spiritually, we're impacted by that, right? Like psychologically, emotionally, we are impacted by that. And some of those things might not ever go back to norm. And so a lot of what comes with the postpartum stage is trying to find a new normal, right? Because a lot of people find that they spend an incredible amount of time trying to get back to normal. And it's like, no, like your life has changed forever, right? Like by this experience. So it's like what's really critical is trying to find what that new normal looks like for you in ways that are okay and safe and healthy and happy, right? So there is the physical, the physical recovery. There are lots of physiological changes. It's tolling because, of course, people think of like the lack of sleep, right? And what it takes to take care of a newborn, which is absolutely true. Like there's also incredible amounts of fatigue that comes along with that, especially for people that are producing milk. Like the energy that is required to produce, like, just to produce milk is unmatched. It would be like trying to run a marathon like every day. Like it takes a lot, and we don't give enough like credit to that. And so a lot of times we have like these cultures that are in this like get back to normal, when it's like, no, the body needs time to heal and it needs time to rest, because the demands on this body to care for another like human are incredibly high, right? And so it's like just to give some grace during that period is incredibly helpful. And then this is another one of those things, lean into the support. And support looks different for different people, right? Sometimes that might mean hiring somebody to come and clean up or make meals for your family, or just to be there and just to have another like adult to talk to, can be like a different type of support. But it's a matter of saying like, this is something that has changed, and this is a big thing, and it's not easy. It's like, what do I need to be successful in this? So the thing with it is that if we have like a project for school or a project for work or whatever, we like make plans, right, for what that looks like. This is one of those experiences that we're just like, yeah, we'll figure it out. And it's just kind of like, this is the biggest thing of your life. Like, have some kind of plan, because, it's like you don't always want to be in this like battle of like winging it, right? And just trying to figure it out. So within the ways to actually like have the baby, there's a couple of different professionals that, that are trained for prenatal care and birth. Most people know OBGYNs. There's also midwives, right? So OBGYNs operate within a hospital setting. If surgical birth is necessary, like a cesarean section, OBGYNs perform that. They operate typically with normal to high risk health care. And so this would be somebody that has like maybe chronic conditions, like diabetes, high blood pressure, liver or kidney dysfunctions, things like that, or if there's something that's necessary for the baby. If the baby has any kind of significant concerns, then this is the specialist that you want to be in, right? Most people don't necessarily have high-risk pregnancies. And so in that case, in the absence of that, there's also midwifery care, which can look a lot of different ways. They can be home births, they can be in a birth center. Some midwives deliver within the hospital. These are like nurse midwives, so they're registered nurses with additional training. Other types of birth would be like a water birth. The thing with midwives is that they're specialists in low risk prenatal care. And so here, the dominant birth attendant is OBGYNs. In a lot of other countries, the primary birth attendants are midwives. There are some practices that have both of these at the same time. So there's a lot of different ways to give birth, right? And one thing that I do want to emphasize is that all types of birth are valid experiences. We have this kind of culture of like mom shaming depending on the ways that people give birth. Like, oh, you did it without an epidural, like, good for you. Like, if somebody took it, like, oh, what's wrong with you, right? Like, or if somebody had a cesarean birth, whether that was emergency or whether that was planned. Like, we always kind of do these things where we make birth a kind of like competitive sport. And it's like, this is not the Olympics. Like, the goal is that mom and baby are safe, like, no matter how they get here, right? Like, that's the ultimate goal. And so this can look a lot of different ways for different people. And so we want to kind of just give grace, like, you know, to that there are going to be different circumstances that will require some of these, and that birth doesn't always go as planned, you know? And so we have to kind of, sometimes it's just a matter of putting ourselves in the mindset of, if plan A doesn't work, what's our plan B, and what does that look like, and how can we still make that be, you know, okay and acceptable and safe and happy as much as possible. So a lot of times when people think of birth and they say, oh, I want like a natural birth, most of the time people actually mean like a natural birth that is like medically and technologically assisted in some way, with different use of tools, something like an epidural, for example. It could still be a natural birth with the use of medication to facilitate that. Or if baby, maybe like the shoulder is stuck, especially if it's a big baby, and maybe they have to use like the vacuum or something like that to kind of like help baby to get out. Still a natural birth, but with the assistance of some type of medical tool or intervention, however it is that you want to call it. So there's that. There's like physiological birth is usually like what people think of when they think of an uninterrupted birth experience, an unmedicated birth experience. So it's not being induced by a certain day. It's not receiving like an IV medication for pain, or an epidural, or anything that's going to change the course of the birth process. And so this is like probably the least common way that people give birth within this country. There's also cesarean birth, which can happen for a variety of reasons, right? And sometimes, you know, I think it's important to recognize that this is a major surgery, and that sometimes people think, oh, she just got a C-section because it's easy. And it's like, this is major surgery that cuts through layers and layers of like muscle. Like, it's kind of a big deal, right? And so nobody gets, in general, right? Most people do not get a C-section because it's easy. A lot of times that is the only way to give birth safely, right? And we have to kind of give the space that's necessary for that. So some people have a planned cesarean birth for a variety of reasons. Some people have an unplanned, an emergency C-section. And so another type of birth would be like a VBAC. And so this would be a vaginal birth like after a cesarean, or a trial of labor after a cesarean, which not all, so, and one of the things that can make or break this for different people would actually be the provider. Not every OBGYN is comfortable doing a VBAC. And so if this is a goal and a way that somebody intends to birth, then to be very selective of your provider is going to be the most important factor, like, for this experience. And so we'll talk a little bit later on about like birth philosophies, but it's like sometimes the birth philosophy between what you want for your birth experience and your care provider, sometimes there's a mismatch there. And so it's like making sure that these understandings about birth are on like the same page is going to be the most critical component of that. So a lot of people, especially from our community, I think that are from different countries where maternity health care is very like woman-centered, are surprised by how maternity health care is like here in America. And so, and I mean, there's a lot of different ways that it can look. One thing that tends to shock people a lot is the lack of continuous support, right? Like people think, like some movie or something, like you go into labor and you call your doctor and they come running and they're there with you until you deliver, and that's not how it is. For somebody to be in hospital, let's say that you're in the hospital for um, 10 hours in labor, which is a lower like estimate for, especially for a first timer. But if you're in the hospital for 10 hours during the labor process, you'll probably see your OBGYN for a total of 1 hour of that, right? The nurses, they'll come, they'll offer, medications. They might help with changing your position, things like that, to kind of like support you, in labor. But it's like, unless there's an emergency, you do not get like continuous support for that labor process. And this is why I'm like, have somebody, whether that's a spouse or your mom, sister, whoever, whatever, right? Have somebody that will be there and kind of like supporting this process like constantly. Because that, and not having that really impacts people in ways. It's like, okay, it's a different room, there's different lights, there's a lot of sounds and things that are unfamiliar, that it creates a high stress environment. So just having a person that is like a comfort for you is really important. And bonus points if they can actually be helpful to you. Things like getting water, things like making sure you've eaten, other things that might be like helpful, are just important for this process. So that's one thing. Another thing that kind of surprises people here is how many men are involved in maternal health care. Most hospitals, the anesthesiologist, the one that will do the epidural, is almost always a man. I believe if you're in this area, St. David's has 2 women. Trying to get them is like finding a unicorn, right? It's very, very challenging to get the female providers that are, that are there. And so most anesthesiologists are men, which isn't, isn't always like a deal breaker, but it is something that people, should be mindful of. The same thing with male OBGYNs. So there are some practices that have like women only for all the care providers. If an OBGYN practice, for example, has men as OBGYNs, like when you go to the hospital, like for your birth, whichever doctor is on call is who will be the one to deliver you. Right? And so this is something that people have to be mindful of in selecting who their care team is, because if the doctor that's on call is a man, then that's, most likely who's going to deliver. Sometimes there's a little bit of wiggle room like with that. Sometimes it's a matter of firing your practice and just getting whichever doctor works directly for the hospital. Which is still a toss-up. That could still be a man. It could be, like another woman. Sometimes there's a little negotiation with it, but a lot of times it's not that uncommon. And sometimes people are surprised by that. So this isn't the kind of place that has like that the obstetric care is absolutely, women in every position of that care. And so another thing that tends to surprise people during this process is the lack of education surrounding birth and postpartum, right? Something as simple as, oh, here's, an epidural, right? It's like the most common thing. It's like, here's an epidural and it can help you like with the pain. And so that might be, kind of like a high level conversation. What we don't discuss sometimes are the risks that come along with that. What we don't discuss sometimes are what's considered like the difference between what's normal and what's common in birth experiences, because these are 2 different things. So just because something happens like a lot doesn't necessarily mean that it's normal, and people should be like mindful of that. And so there's a ton of great like childbirth education classes that can kind of go over, this information like in detail. But I would say that like do not depend solely on your OBGYN to tell you everything that you need to know about birth. Because that will leave you really short, in terms of things that are going to be critical information for you to make the best decisions for yourself and your health. And another thing is, it's just going to be variations within birth philosophies. We talked about it a little bit earlier, but there are a lot of different ways to approach birth, right? For some people, it's like, oh, this is like the most natural experience or whatever of your life that maybe sometimes needs medical help. For other people, the approach of this is a very medical like event that just happens to happen to humans like all the time. So it's like the way that we approach birth has a huge impact on how we view what's necessary and at what time. And so this is, when I say that, that it's important for you and your birth team, whoever that is, to kind of be on the same page. That's what I mean, right? Like if you have a provider that's very heavy in regards to medical like interventions and starting labor when you don't necessarily want to start labor, like that might change how you that might change your labor and birth experience a lot. And it's important to consider that there can be a mismatch there. So again, I'm like, this is the biggest thing of our lives, and it's important to just have a plan, whatever that plan might be, right? We don't always have to have it written down, but just to at least think about it is important. Like who's going to be at your birth, right? Like a lot of times, and I say this because sometimes we feel like, oh, I just want like, or we have like cultures that discourages like the dad from being there, right? Whereas like we have a lot of research that actually suggests that dad is like the most critical person to be in that space, and that can provide a lot of like calm and comfort to the mom that's in labor. Sometimes we think, oh, well, I just want like my mom there. But we don't consider if you don't have the best relationship with your mom, that might be an additional stress to you while you're in the process of labor, right? And so who you expect to be with you, like not just in the space and taking up space, but who's going to actively be supporting you is going to be one of the most critical things within this birth experience. And so to think about like what pain management might look like. If it's like, oh, I just know that as soon as I hit one contraction, I want the epidural, and that's it. That's fine, but it's also a matter of recognizing that at a certain point, even the epidural doesn't help, right? So we think about pain in the sense of, one thing is that pain and pressure operate like within the same way, within the body. So it's like if you're feeling pain, then you aren't feeling pressure, and vice versa. So a lot of times, like let's say you get like a headache and it's like, oh, my head is throbbing, and if you just like squeeze your head, then the pain goes away, and then, or at least diminishes, right? And sometimes you'll just feel the pressure of like squeezing your head. So the epidural can kind of be like that. Like it can take away the pain, it doesn't do anything for the pressure. And so a lot of times people get the epidural thinking that it's like smooth sailing and whatever after that. Not that it isn't for the most part, but there's a point where even that like doesn't help. So it's like, what's the plan after that? And what's the plan while you have it too? Because it doesn't always, it's another one of those things that doesn't always go as smoothly as people expected, and it's because sometimes we don't understand the risk and maybe the side effects and things that come along like with that. And so, and this isn't to discourage the use of it. It can be an incredibly valuable tool, right? But it's a matter of when it's effective, what the risks are, and when it's actually like not helpful. And so these are the things that we have to kind of think about whenever we're creating life, trying to figure out what this plan might actually look like. What does it mean to be an active participant within your own birth? And again, like I said, a lot of times people go through this experience and they feel like this is just something that is happening to them, right? And they don't feel like they have any control, and they don't feel like they have any autonomy. This leaves people with an incredible amount of trauma surrounding their birth. And so sometimes it's just a matter of saying like, this is like my body, this is my baby, right? Like this is what I want this to be like, and then I'm okay with this and this and that if something else like needs to change, right? But instead of just feeling like something is being done to you, it's empowering to say these are the decisions that I'm making for myself and my life and my health and my child. And so part of that is to kind of look at what the ideal birth looks like. A lot of us don't think about like that on a big scale, but it's like, is it, everybody coming over and eating like while mom is laboring, and you're just surrounded by people that you love and kind of hanging out? Is it a very like calm space? Right? Is it a very like prayerful space? Is it a very like sacred space? This might look differently for different people. And that's okay, but it's just a matter of trying to figure out like what is ideal like for you, because again, it's a very major life event. And so one of the things that I think is really important is like to say, when we're thinking about like this plan and what this looks like, it's like, what do I need? What do I need to know? What do I need to do to have this be successful, right? Think about it in the scale of setting a goal and making a plan. Like, what does it look like to actually get there, you know? Instead of, again, like I said, just winging it for this very, very critical thing. So general guidance in terms of pregnancy would be overall just try to improve like your health. One thing that I see within the community a lot is that a lot of us have significant health issues before becoming pregnant, and then pregnancy worsens some of those conditions, right? A lot of people tend to have things like poor liver health, right? Like, I mean, it's one of those things where health in general, but especially within the Muslim community, there's certain things, you know, like we mentioned before, or whatever, that some things like different nationalities might have a higher prevalence of them. Like, okay, South Asian people like might be more prone to liver like issues and high cholesterol issues. For people who are pregnant, this worsens with pregnancy. And so a lot of moms find themselves with a condition like cholestasis during pregnancy, or you know, other types of liver disease, or maybe even postpartum having to have like a gallbladder removal because a health condition wasn't addressed prior to pregnancy. So, you know, the best tip is going to be like get as healthy as you can before pregnancy, and then actively continue to work on your health during the process of pregnancy. Another thing would be to increase or improve like our physical health, because pregnancy is incredibly demanding. A lot of us have, because we tend to lead like very sedentary lifestyles, a lot of us have very like poor muscle tone. Birth is a lot, right? And it's very like physically, incredibly physically demanding. And so it's kind of like the better physical fitness we have, right, can improve our chances of having a healthy birth. I don't want to say successful, because it's successful, like, you know, no matter, again, like the birth process that it takes or whatever to get here. But in terms of like healing and recovery, being physically like fit enough for this process is going to be one of the more like critical things. Eating well can offset a lot of the negative experiences that people have during pregnancy and birth and the postpartum period. Stress is a huge thing. And, you know, for people that understand like the process of birth, we really put stress as a factor as being just as dangerous as like heart disease. Like, it's absolutely critical that we can kind of like manage, you know, like stress in healthier ways, because the manifestations of that are very serious. And so, you know, we think about it in the sense of during pregnancy where our organs are under really high demand. That includes the heart, right? And our heart and blood pressure are going to be like the most vulnerable within the birth process. So, but yeah, so it's like learning how to manage stress is going to be one of the more critical things. So general, you know, like, I guess tips for birth would be, for one, like, you know, just to put our trust in Allah, right? Like, it's easy to worry about like this and worry about that and worry about that. It's kind of like, okay, we do our part, but we tie our camel, right? And so, you know, and then with that, like, after you've done your part, then your trust, you know, lies with Allah. We have to understand that like what's for us is for us and what's not is not, right? And so we do our part like proactively to try to maintain our faith, because it can be a very like spiritually demanding and challenging like process. And so making dua, like one thing I encourage moms to do is kind of like make a dua list, because when you go to birth, they're like, oh, you see this dot like on the wall, just stare at it until your baby is here. That doesn't work and it doesn't help, right? But it's like if you actively are making dua for yourself, for your family, for your baby, for your friends, for people that you love, like you become more, like it gives you something to do, right? If nothing else, and it helps to kind of like pass the time. Plus it's also like, this is when we are the closest, right? Like to Allah. So it's like use that time like beneficially, right? Like make use of it. So, and then, of course, you know, like dua for yourself and like, you know, the experience, the process, the healing and the recovery from that, like as well. Another thing that's really critical is like to trust your body. a lot of us have incredible amounts of doubt about like what we can do and what we're capable of. And sometimes, even whenever we see that other people do the same process, instead of being like inspired by that, it makes us feel more inadequate that we could never do that, right? Like, or, it's like, oh, my mom, like, worked, and then, and she was working all day, and then like, and then she had the baby, and like in 2 days later, like she was back to work again. And it's, you know what I mean? Like these kind of stories that we like glamorize, that aren't don't serve as inspiration. In a lot of ways, they make us feel like worse about like what's actually happening, what's, what we're experiencing. And so it's just kind of like to say, like, block the noise, like this is your birth, right? It's not your friends, it's not your moms, it's not your sisters, it's not like your aunt, it's your own birth experience, and that you have to own that and like kind of claim that for yourself. And you have to kind of trust that your body knows what to do, that your baby knows what to do, and that y'all are like a team to get through this process together. Because a lot of times people feel like, especially whenever it comes to labor, and especially once we pass that due date, right? Then they feel like, okay, my friend had her baby at 38 weeks, I'm 40 weeks, and labor hasn't even started for me. Like, my body must not be capable. It's like, no, your body just needs more time, right? Like, your baby just needs more time. And we have to kind of respect that these are very individualized experiences. And so, again, it's not the Olympics, right? There's no competition within that. It's kind of like your body is your own. And so one thing I think that's really important to recognize is that, like, when baby is complete, right? Like, the lungs are the last thing to develop. When baby is, like, complete, then it kind of sends, like, a hormone that says, okay, now is, like, the time for labor. So the initiation for labor actually comes from the baby. It doesn't start with the mom. So it's like, okay, if labor hasn't started for you yet, your baby's not ready, right? And babies don't care about your due date. And like when you say, that you want to have, oh, I want this baby's birthday to be on whatever day, because that's my mom's birthday. Your baby does not care, right? And so part of it is just respecting that, like, babies come whenever they want to, and they don't care about our deadlines, right? And they don't care about, the fact that we have like something planned or whatever for that day, or that we're looking forward to the day. Like, it's just not how it works. Right, and we just have to kind of respect that process. So while we're waiting, the best thing that we can do is just take care of ourselves, right? Like, protect your mental space, hydrate and eat well, take care of your body, do all the things that you can, like, while you're waiting for baby. And then once labor starts, like, either rest or busy yourself. And I think this is something to kind of like balance out, because there's a part of labor that is kind of easy to ignore. Like with most people, labor is a slow and gradual workup. You might have one contraction, it's like, oh, that's weird. And then another one like an hour later, and then that pattern like stays. And then maybe every like 30 minutes or something like that. Like, there's a gradual like workup between the frequency and the intensity, right? Like, early contractions just feel like you're being like hugged. Like, if you're wearing pants that are like too tight after you went to a buffet, like it kind of starts like that, right? And then it's like a wave that it goes from like, tightening to like maybe pain, and then it decreases. So each one is like, you just like kind of ride the wave of it. But early contractions don't necessarily have pain that's associated with them, so it makes them hard to identify. So even if you feel like you're having that, ignore it until you can't ignore it anymore, is like the best way to get through labor, right? Because again, that can be a day, that could be 2 days, that could be 18 hours, like whatever, that can be the longest like process. And then it hits a point where you can't ignore it. So when you can't ignore it, then have your plans in place to like, for movement, for something like counter pressure, for massage and like in breathing techniques, all these different things that will kind of help you through the process of when it gets more active, right? So when contractions are like even up to like 20, 15 minutes apart, they aren't usually like painful. Once they get to, 7 minutes apart, they'll get your attention for sure. And so it's kind of like, as much as you can distract yourself, then do it. Like, I've had people's like, oh, I'm just gonna go and walk like around whatever, HEB, Walmart, a grocery store, IKEA, whatever you wanna do, like to busy yourself, then like, then do it. It's like, yeah, I'm having contractions, still gonna go like to lunch, still gonna come to the masjid, like whatever. As long as you can't ignore it, then go ahead and do that. One of the bigger things that I think is really to be informed about like the labor and birth like process, and like recognizing that the more, not too much information, there are some things I think that are too much information, but to have a certain amount of understanding of the process and what the standard like medical procedures are like, for this. Be like truly informed about that. That's what will empower you like within this experience. That's what will offset some of the fears that we have, and some of the doubt that we have, and just a lot of the uncertainty about it. And so so with that, it's one of the things that I think is really important to consider is that a lot of times whenever it comes to the labor process, especially as we get concerned with like interventions, right? Like the tools that assist like birth. A lot of times we'll give like the benefits of those things and we just like ignore the risk of those things. And that leaves us with, for one, inadequate like information. For two, it's like it's harmful. Because again, it doesn't mean that we shouldn't like use these tools, but it's a matter of saying that like a lot of times we don't recognize the ways, all the different ways that birth can actually go wrong. And it's like, and we're surprised by that. And then there's another layer of like just trauma and struggling to cope with that just because of our ignorance about something, right? So part of it is, so epidural is going to be one of those things that we see like the most, right? Because sometimes as soon as people find out that they're pregnant, like, yes, I'm going to get the epidural, like, which, I'm like, again, that's your choice, like, more power to you. One thing with it is that, like, I always think, like, if people are going to take it, the timing is everything for the epidural, right? Because there's a certain point that like that labor can kind of like yo-yo a little bit, and so it can kind of go back and forth up until the cervix is like 5 centimeters, for example. So it's like if we're in that stage of labor, like really yo-yoing, to take the epidural before it like hits the point where it will only like progress can kind of like make labor slow down and stop, right? And so so it's important to recognize that like if labor fails to progress at a certain point, then that usually ends up in a cesarean birth. And so it's like, let's get past the point of, like, there's a point of no return, right? So it's like, okay, if we take it at the, after the point of like of no return is usually when it will continue, labor will continue to go on, with or without like, the epidural. And so, but then there's also the thing of, remember I said that there's certain points that the epidural does not help. So, we have that, for most people know that like to be able to have the baby come out, the cervix has to, which is the opening, has to like reach 10 centimeters, for example, right? So to get up until like 7 or 8 like centimeters is actually considered like the peak of pain, right? After that, it's a lot of pressure. Epidural does not help with pressure. So between 8 and 10, it's like pressure only. I mean, there might still be like, some pain there, but taking the epidural at like 8 centimeters, it's like, it's not really gonna help, right? So if somebody's like, I know I'm gonna get it, ideal window for an epidural would be between 5 and 8 centimeters. Right? And that's when it will be the most helpful. That can allow mom to like to take a nap. But this is the thing where they're like, oh, just get it and then you don't have to worry about anything and you can like take a nap and we'll just wake you up when you're ready to like to have your baby. Which sounds amazing, but it's not true. Because again, there are, a lot of things that we have to consider with that. Biggest risk in regards to the epidural is that mom's heart rate drops. Right, that baby's heart rate starts to decline. And so again, it's not a matter of like, oh, avoid it completely. It's to say that like, this is a risk that's worth at least mentioning to the person that's going to receive it, right? Because if mom's heart rate starts to drop, if baby's heart rate starts to not tolerate this labor process so well, automatic C-section. Right? And so it's a matter of saying, we can acknowledge these things and we can make decisions for ourselves. Like, is this a risk that's worth taking? Sometimes, absolutely. Right? And sometimes it might be like, let's just wait and see, and see if we can wait a little bit longer or if this is like the best decision for this time. right? The same thing whenever it comes to induction. This is another one of those things where they're like, oh, well, you can schedule it, and if we schedule it on this day, then your doctor will be there, and we know how much you like your doctor, so do it whenever we know that your doctor will be there. And we kind of frame it in this like really, like positive way, which is understandable. At the same time, one thing I think that's important to think about, like with induction, is that it is forced labor. If your body is not ready for birth, then your body's not ready for birth. And so this is why we find a lot of times that moms get labor induction, and then they are in labor for 2 or 3 or 4 days and still haven't had their baby and still end up with a cesarean section, right? Because the body just was not ready. So it's like, if it doesn't, like if it's not ready, then it's not ready, and we can only encourage it so much, but forcing it can be dangerous. Like there was this thing, I don't know if anybody saw, it was like, I think he's a soccer coach or a football coach, and they were like, oh, he had this game, and the game was really critical, but his wife was due, and so she agreed to get like induced early just so that he could make like, his soccer game or whatever, like on time. They're like, yay, she's the hero, and saved this game because the team won. And it was just kind of like, wow, she just risked her life and her baby, like for a soccer game, just to be like for this guy's like schedule, and not to say that it isn't like important, but there are significant risks that come with forcing labor when the body's not ready to labor, right? And at the same time, there are times when when labor induction is absolutely medically like necessary, right? And this is the thing, we're coming up on, the fall and like in winter holidays. People that are usually due in like the Thanksgiving, Christmas, New Year's break typically see medical inductions at higher rates than people do any other time of the year. And it's unfortunate that a lot of times it's to schedule around, the doctor's like availability and stuff like that. So it's kind of like, oh, we don't want you going into labor on Christmas. We might as well like get you in the week before, right? Which a lot of times, more often than not, it's a matter of convenience, either for the provider or for the family, or different like reasons, and not always a medical necessity. And so that's something to, for us to kind of consider. So in general, the guidance is kind of like, if something isn't an emergency, then it can be a conversation like with you, and not a decision that is made like for you, right? That we can give a little bit of input, and we can kind of say, well, what are the, alternatives? What are other things that we might want to consider? So I really want to encourage families, to like use your brain. Like there's this acronym, and I love it because I feel like it kind of puts into perspective what it takes to, to be able to make decisions like for ourselves, right? Like anytime it's a medical decision, it's like, what are the benefits of that, right? For one, are they true benefits? Because a lot of times we get something that is framed as a benefit, and it might be more of a convenience than actually be like helpful, right? What are the risks that come along, like with that? And are those risks like necessary? Are they worth it? What alternatives are there, right? So something like, and this is, again, it's going to be limited by, for one, the skill and the knowledge of, especially whenever it comes to alternatives. Some of that is going to be limited by the skill and understanding of our medical like providers. So something like a breech baby. Like baby is, instead of being like head down and like and ready for birth, baby is like sideways, baby has a foot down, or some other like position, baby is like shoulder first rather than like then head first. So this is considered like breech. Some providers will say this is the automatic C-section, right? It's not that that baby can't be delivered. It's going to be limited by the skill of the doctor. Some doctors will actually do an inversion where they'll like manually, it's painful, but they'll manually like turn baby, right? Like that's one option. Some like providers will actually deliver a baby breech. So it's like, if labor progresses and it's safe enough to do so, there are babies that have been delivered with like feet first instead of head first. It's not impossible. It's going to be limited by the care provider. But then there are alternatives like moxibustion. I don't know if anybody's heard of it. It's like acupuncturists usually do it. It's some kind of like herbal like cone, and while they're doing the acupuncture session, they'll put like these steam like herbal cones. It's incredibly effective for changing a breech baby. Like just this summer, I saw 2 like moms that were breech, and both babies were turned with moxibustion. So no side effects, no risk. It's not painful. It's like either it works or it doesn't, right? But it has like, I think the success rate on it is like 95% like success rate. It's, you know what I mean? Like it's a very simple thing that's incredibly like low risk. And so it's a matter of saying like, are there alternatives that don't carry as much risk? And so part of it is also following our gut, right? Like what is your instincts telling you to do about this particular situation or in making like this decision? And learning to trust ourselves within, within our own bodies in that experience. And then sometimes the question is just like, what happens if we do nothing, right? Like what happens if we wait? Which sometimes a lot of things that you'll find in birth, a lot of things will actually resolve themselves when you just like give it time, right? So something like whenever, people are getting a lot of medical intervention, and it's like, okay, you've gone for an induction, and then you've gotten the epidural, and then you're getting the Pitocin. It's like, that's a lot for a baby, right? Sometimes just spacing these out and saying, let's just give baby a little bit of time. Let's just pause, give baby a chance to recover. We don't have to go to the next thing, right? So sometimes nothing can be the most effective thing whenever it comes to the birth process. I have no idea how I'm doing on time, but I'll keep going until somebody stops me. So the next part is going to be about like dads, because we find that, for one, it's really beautiful to see that like dads are kind of showing up, for their wives, like in this process. I think that that's a huge shift from the experiences that people had, where it's like dad wasn't even in the room or maybe even like at the hospital. And so that's a really nice transition that we've seen. One thing with it is that like recognizing that dads matter and they're important like to this space, and that like your job is going to be to build trust and safety, and just provide a sense of security for mom like as she's laboring and like, and giving birth. Part of that is like establishing trust before the birth process, right? Like if she can barely like trust you to cut an orange like properly, she's probably not going to trust you to like be her support person during the birth process. So it's kind of like, how can we build that before it becomes like critical, right? Like how can we build the skills of being her advocate and being her voice when it is absolutely necessary, especially if she's not in a position to like advocate for herself. There's a lot of different types of support, right? And that can be physical support, and that can be like emotional, support if she's having a hard time. And that also means to kind of like protect that birth space, right? Like letting mom kind of lead the way in the birth process, and then trying to do your best to facilitate what her ideals are like for this process, and protecting that space for her, because sometimes it might be something like maybe someone is like there that she doesn't necessarily want to be there. Maybe there is an issue or a personality thing with the nurse, or with, like her, like if her mom is there or whatever, and it's like you can tell her mom's stressing her out, or if your mom is there and you can tell that your mom is like is stressing her out, like how can you be a better like bridge and support for her to mitigate like some of the stresses that come along with that, right? And so this comes along with protection, and this is advocacy. This also means taking care of yourselves too, right? Like, because this is a hard process for dads as well. Some dads do not tolerate birth very well. And so it's like the last thing we need is for you to pass out when mom is giving birth, right? So eat, drink your water, don't forget to breathe, right? Because we have enough like patience for that time. And then also just making sure that you're managing like yourself well. Another thing, because some dads are like, oh, I'm just going to be there. She's going to be giving birth and I'm going to be doing nothing. I'm going to bring my PS5. This ain't the time. Right? So we've seen that before, where guys are bringing like full PlayStation and gaming systems and stuff or whatever, like for the birth process, because they think they'll be bored, right? So we will pause here, or just stop here. Sure, inshallah. I know it's a lot of information. I apologize if it's overwhelming, but I want to thank you all for your time. Jazakallah khair. Assalamu alaikum.
Feel free to connect with Sister Shanada on the side. And inshallah, we'll look at possibly scheduling another session in the future, inshallah, to cover the remaining material. Inshallah, this is a topic which is ongoing. Muslims are famous for having a lot of kids, alhamdulillah. So we will always need this topic. So inshallah, the video is there. You can share it with people. We did have some problems, but alhamdulillah, we managed to fix it. So after like the first 10 minutes or so, the rest of it is live. Feel free to share with others.